Phlebotomy Practice and Quality Assessments, Chapter 1. Chapter Objectives. Upon completion of Chapter 1, the learner should be able to do the following. 1. Define phlebotomy and describe phlebotomy services. 2. List professional competencies for phlebotomists. 3. List skills for effective communication. 4. Describe the essential steps for a job search. 5. Describe basic principles of quality and list examples of quality assessments for phlebotomy. Phlebotomy practice and definition. The term phlebotomy is derived from the Greek words phlebo, which relates to veins, and tomy, which relates to cutting. In ancient times, phlebotomy was practiced to withdraw blood using various means, including knives, crude lancets, leeches, blood cups or bowls, pumps, and glass syringes. In some cultures, phlebotomy was thought to cleanse or purify the body and or get rid of unwanted spirits. However, today, the current definition can be summarized as the incision of a vein for the purpose of collecting a blood sample, a portion of blood removed that is small enough so as not to cause harm, for laboratory testing or other therapeutic purposes, such as blood donations. Modern phlebotomy equipment and practice have improved significantly. For purposes of this text, phlebotomy practices that are covered relate to the two most common techniques: venipuncture, withdrawing a venous from a vein, not an artery; blood sampling, using a needle attached to an evacuated tube system or other collection devices covered in chapters 6 and 8. Skin puncture, puncturing a finger with a specially designed safety lancet to withdraw a smaller amount of capillary blood, covered in chapters 6 and 9. Patients' blood specimens are discrete portions of blood taken for laboratory analysis of one or more characteristics to determine the character of the whole body. Laboratory test results are used for three important reasons: diagnostic and screening tests, to figure out what is wrong with the patient or to screen for abnormalities; therapeutic assessments, to develop the correct treatment or choose the right drug for the patient's medical condition; monitoring health status, to make sure that therapy or treatment is working. The phlebotomist or blood collector is the individual who performs phlebotomy. Phlebotomists can also assist in the collection and transportation of specimens other than venous blood, such as arterial blood, urine, tissues, and sputum, and may also perform clinical, technical, or clerical functions. However, the primary function of the phlebotomist is to assist the healthcare team in the accurate, safe, and reliable collection and transportation of high-quality specimens for clinical laboratory analysis. This means that each and every patient specimen should be correctly identified, collected, and transported to the laboratory. The reliability and accuracy of all patient test results depends on the pre-examination or pre-analytical phase of specimen collection. That is, the part of the process that occurs before the actual testing and analysis are performed. The pre-analytical process is the fundamental and crucial domain of every phlebotomist. See Figure 1.1. Members of the healthcare team and phlebotomy duties. Phlebotomist duties vary in scope depending on the setting, as illustrated in Box 1.1. They may have duties related to all phases of laboratory analysis or may be assigned to duties in only one area of the hospital. Technology has also enabled laboratory testing to be performed closer to the point of care or the patient's bedside, at ancillary or mobile sites, or even in the home. Point of care testing, or POCT, includes low-risk laboratory tests or clinical procedures such as glucose screening, hematocrit, fecal occult blood tests, or FOBT, urine dipsticks, throat swabs, etc. In some cases, health professionals such as nurses, medical assistants, respiratory therapists, patient care technicians, and others have been cross-trained to assume phlebotomy duties. In other cases, traditional laboratory-based phlebotomists have been cross-trained to assume expanded clerical or patient care duties, such as electrocardiograms or EKGs, and low-risk laboratory procedures. Whatever the case, phlebotomists must work closely and professionally with a variety of healthcare professionals. See Box 1.2. Clinical laboratory personnel, Box 1.2. Pathologists, physicians, medical doctors, MDs who have extensive training in pathology, the study and diagnosis of disease. Administrative management or staff, individuals who may have a graduate degree in healthcare administration or business. technical supervisors, medical laboratory scientists, and additional experience and education in a laboratory specialty area such as hematology, microbiology, or clinical chemistry. Medical laboratory scientists, certified professionals with bachelor's degree in biological science. Educational requirements include 1 or more years of study in an MLS program. Licensing is required in some states. Roles and responsibilities include performing chemical, microscopic, microbiologic, or immunologic tests pertaining to the patient care, recording and reporting test results, participating in research and development of new test methods, performing preventive maintenance, troubleshooting, and quality control of instruments and reagents, maintaining safety in the clinical laboratory, and teaching residents and fellows in pathology and laboratory sciences. Medical laboratory technician, MLT. Individuals who have a 2-year certificate or associate degree, the MLT, may perform designated tests and procedures, prepare specimens for testing and transport, prepare reagents, perform quality control measures, and assist the MLS in numerous pre-analytic and post-analytic processes, as well as performing limited analytical processes. Phlebotomists or phlebotomy technicians. Individuals with a high school diploma and specialized phlebotomy, educational, and clinical training. Most phlebotomists take a certification examination. More information is presented in the following section. Medical assistants. Individuals who have completed a medical assistant certificate, often in conjunction with an associate degree. The MA in a laboratory setting may perform phlebotomy procedures, specified low-risk laboratory tests, basic patient assessments, blood pressure, etc., specimen processing and handling, and clerical duties. Certified specialists. Individuals who complete required experiences and a certification examination in a specified area of the laboratory, such as blood banking, hemophoresis, microbiology, clinical chemistry, hematology, laboratory safety, and laboratory management. Other laboratory personnel. Doctoral level scientists who specialize in special areas such as immunology, microbiology, laboratory information systems, operators and programmers, clerical staff, quality management staff, infection control officers, and biomedical equipment specialists. The clinical or medical laboratory is closely linked to all phlebotomists because it is the final step for blood specimens that are collected and analyzed. There are many types and sizes of laboratories. However, Figure 1.3 provides one example of clinical laboratory, and Box 1.2, which I just read, describes laboratory personnel with whom the phlebotomist would likely work. Professional competencies and certifications. A high school diploma or its equivalent is most often required to enter a phlebotomy training program in hospitals, community colleges, or technical schools. Typically, the length of the training varies from a few weeks to months, depending on the location, the size of the facility, and the complexity of patients being served. Prior to acceptance and/or employment, programs will request a criminal background check, a drug screen, and/or evidence of specific immunization, including hepatitis B vaccination series. Employers also often require phlebotomy certification, which is accomplished by passing a national certification examination. Certification provides career advantages through job opportunities, career advancement, and portability. It is recognized from state to state. Some states, such as California, require phlebotomists to be licensed and may accept applications from students trained only at approved schools and who have passed approved certification examinations. Thus, it is important to double-check the requirements in different areas of the country prior to entering an educational program. Professional organizations that recognize phlebotomists are listed in Table 1.1. Many of these organizations have developed competency statements to describe the entry-level skills, tasks, and roles performed by designated healthcare workers. In addition, some offer continuing educational opportunities via conferences, webinars, or online coursework. Professional organizations may provide guidelines for healthcare organizations to set standard operating procedures covering the practices, conduct, behaviors, and actions that are acceptable in the field. The organizations listed in Table 1.1 have an interest in promoting and improving the practice of phlebotomy. Table 1.2 is an example of one organization's list of competencies for entry-level phlebotomy technicians. At minimum, these are the types of competencies that an employer might assess for the phlebotomist performance evaluation. Competency statements on the certification examination with regard to anatomy and physiology, specimen collection, specimen processing and handling, and laboratory operations related to phlebotomy, and in accordance with established procedure. The phlebotomy technician, or PBT, ASCP, appendices for a more detailed CP at career entry should be able to accomplish the task listed in Table 1-2. Also refer to the appendices for a more detailed list of competencies from the National Accrediting Agency for Clinical Laboratory Sciences, or NAACLS. In addition to competencies just discussed, Box 1-3 encompasses duties and professional attributes, ability and performance measures that employers might use for a phlebotomist performance evaluation. Performance measures are observed through the phlebotomist behavior, approach to the job, knowledge, and skills. There are many ways for supervisors to assess competency: direct observation, video recording, skills tests, reviewing worksheets or logbooks, reviewing quality control records, and using simulations or written examinations are some. Performance evaluations are important to both the employee and the employer because they provide feedback, identify problems early, promote consistent evaluation, encourage employees to stay updated and to improve their skills, and provide record of competency. Box 1-2 shows the American Society for Clinical Pathology, or ASCP, Board of Certification Competency Statement for the phlebotomy technician. In regard to circulatory systems, specimen collection, specimen processing and handling, point-of-care testing, non-blood specimens, and laboratory operations related to phlebotomy, and in accordance with the established procedure, the phlebotomy technician at career entry applies knowledge of principles of basic and special procedures, basic anatomy and physiology, pre-analytic or pre-examination variables, standard operation procedures or SOPs, medical terminology, regulatory requirements, fundamental biological characteristics, patient and personal safety, and infection control. Selects appropriate course of action, equipment, methods, reagents, and samples, quality control procedures, and site for blood collection. Prepares patients, samples, and equipment. Evaluates specimen and patient situation, quality control procedures, appropriate actions and methods, sources of pre-analytic or pre-examination variables, common procedure technical problems, and corrective action. Professional character traits. Within the health professions, organizations such as ASCP and MPA have developed standards of ethical conduct and behavior for members, and members are expected to adhere to those standards of performance. The major points are as follows. Do no harm to anyone intentionally. Perform according to the sound technical ability and good judgments. Respect patients' rights, which includes patients' confidentiality, privacy, the right to know about their treatment, and the right to refuse treatment. Have regard for dignity of all human beings. Box 1-3 shows typical clinical, technical, and clerical duties and attributes of the phlebotomist. What are the clinical duties of the phlebotomist? Communicate professionally with patients and coworkers, identify the patient correctly, assess the patient before blood collection, prepare the patients accordingly, perform the puncture, withdraw blood into the correct containers or tubes, assess the degree of bleeding and pain, assess the patient after phlebotomy procedures. What kind of technical duties do phlebotomists have to perform? Manipulate small objects, tubes and needles, select and use appropriate equipment, perform quality control functions, transport the specimens correctly, prepare, process the sample for testing analysis, assist in laboratory testing procedures, washing glassware and cleaning equipment. What clerical duties are expected of phlebotomists? Print, collate, distribute laboratory requisitions and reports, work on secure computers, facsimile machines, printers, and telephones, answer all queries as appropriate, demonstrate courtesy in all patient encounters, always respect privacy and confidentiality on and off the job. What kinds of policies must phlebotomists adhere to? Safety in the laboratory and patient's room, infection control, gowning, gloving, and hand hygiene, fire prevention and control, dress codes, attendance, sick leave, and vacation. What kind of communication skills do phlebotomists need? Verbal, nonverbal, listening skills, telephone etiquette, written communication, use of medical terminology appropriate for patients and coworkers, management of angry or difficult patients. How is the quality and productivity of phlebotomist work measured? Quality can be measured by waiting times, lack of complications or mistakes, contamination rates, etc. Productivity is often measured by the time and attention given to patients and to detailed procedures, and by the the output of work based on how much work is completed during specified amounts of time. Important character attributes for this career path include sincerity and compassion. Phlebotomists must possess a intense desire to serve people and a sincere interest in learning about blood and specimen collection practices, as shown in Figure 1.4. Emotional stability and maturity. Healthcare workers must be able to cope daily with seeing others in pain, handling blood and body fluids, facing injury and trauma, seeing disease sites, and the possibility of observing death. Responses to harsh situations must be prompt, professional, and reassuring to the patient, their families, and the healthcare team. Accountability for doing things right. Personal integrity, veracity, telling the truth, and doing what is right when no one else is looking, such as washing hands between patient collections, observing precautions to gown or scrub in isolation, reporting one's own mistake, and collecting time tests at the proper time. Reflect the healthcare worker's personal responsibility for his or her actions. Dedication to high standards of performance and precision. Healthcare workers must continually upgrade and maintain the quality of their skills. They must seek knowledge about new techniques and safety procedures, new supplies and equipment, and computer technology through continuing education. They should be willing to ask for assistance when dealing with difficult patient or procedure and have the desire to follow rigid standards of performance. They should only collect the specimen order and only those that they have been trained to collect. Respect for patients' dignity, privacy, confidentiality, and the right to know. Phlebotomists have an obligation to respect all patients' rights regardless of their personal opinions and biases. All patients must be treated with dignity and respect regardless of race, culture, religion, gender, age, or disabling conditions. Phlebotomists should have a full understanding of patients' rights to privacy, to confidentiality, and to knowing what procedures are being performed. Propensity for health and cleanliness. Phlebotomists must protect themselves and patients by accepting that sterile techniques, good personal hygiene, keeping a healthy mind and body, and cleanliness affect safety and quality of health care. See Figure 1.5. This is more important than saving time or cutting corners to save money. Pride, satisfaction, and self-fulfillment on the job. Phlebotomists should attain professional satisfaction from continually improving their professional skills and knowledge, from knowing that others are dependent on the quality of their work, and from knowing that their skills contribute to the betterment of patients. The most successful, highly regarded phlebotomists are those who are most gratified with their work. Working with team members. Phlebotomists must be flexible enough to work with a diverse healthcare team in a wide range of settings. Healthcare teams can improve skills, more talent, expertise, and technical competence. Communication, more ideals, mutual respect, crossing departmental lines. Participation, increased job satisfaction, combined efforts, value above individual efforts, and effectiveness. Solutions are more likely to be implemented because the team has shared ownership of the decisions. Take pleasure in communicating with patients. The quality and ease of collecting blood specimens depends on both the technical skills of the healthcare provider or worker and successful interactions with the patient, as seen in Figure 1.6. Phlebotomists should learn about transcultural communication strategies, communication barriers, and gender or age-related issues that affect communication. The decision to become a phlebotomist requires a special person with multiple talents and internal drive. It can be a stressful job, and individuals choosing this career path must be able to balance the challenges. The choice of this career path should not be taken lightly. Test your career readiness level with the assessment in Box 1.4. Box 1.5 provides some tips for relieving stress and staying physically and emotionally healthy. Box 1.4, Phlebotomy Career Self-Assessment. If you are considering a career in phlebotomy, ask yourself the following questions. If there are doubts in your mind about your answers, think about whether you are willing to change or learn new skills. Do I pay close attention to details? Do I like to work with small objects such as needles and test tubes? Do I follow procedures exactly? Does it bother me if I'm closely watched or supervised? Do I mind seeing blood, sick patients, body tissues, or fluids, or smelling unpleasant odors? What is my reaction to inflicting the pain of a needle stick on someone? Am I willing to admit my own mistakes? Will I be truthful even if the consequences are negative? Do I like working with a team? Do I get along well with other people? Am I willing to stand for long periods of time, walk extensively, reach, stoop, lift, or carry equipment? Am I willing to work on holidays and weekends occasionally? Box 1-5, 10 tips for relieving stress. Find time to do your own thing. If you need privacy, structure some quiet time for yourself to meditate, prayer, etc. If you need an outlet, structure time for a hobby or a diversion outside of work to remove yourself from the stress, even if it is a brief period of time each day or week. Look for humor in daily situations or associate with gentle people who can help you laugh or lighten up. Number 3, think of new ways to get exercise so that it doesn't get boring. Try adding a new exercise to your routine every few weeks. Try a new dance class or exercise form. If you cannot schedule an entire class, try short exercise sessions. 10 minutes or at 3 different times of the day is better than none at all. Eat nutritious, low-fat foods and consider taking vitamins if your diet is not providing all the necessary nutrients. Think of your plate with at least 50% vegetables, 25% proteins, and 25% carbohydrates. Take more control over the sources of your stress. For example, if cooking meals after a hard day's work is stressful, cook multiple meals on your day off and freeze the rest so that they are easier to prepare during the busy work week. If getting kids dressed and fed each morning is causing you to be late for work, lay out their clothes and breakfast foods the night before. Read interesting books, listen to new music, or watch interesting movies. Number 7, keep a life journal or a dream journal. If you forget to write in it, just skip a few days and pick it up again when you feel like it. 8, go occasionally to a performance such as a concert, play, or dance program. Try to see an art exhibit or an art gallery open house. 9, avoid harmful habits such as smoking, drinking excessively, or unnecessary drug use. 10, do not be afraid to seek professional assistance when needed. Professional appearance and personal health. Appearance, grooming, and physical fitness. Posture. Phlebotomists usually perform their work while standing. There are occasions, however, particularly with ambulatory patients, when it is more effective to sit adjacent to the patient for the blood collection procedure. Erect posture conveys a sense of confidence and pride in job performance. Slouching conveys a sense of laziness and apathy. Good posture minimizes back and neck strain, promotes better breathing, and eases the patient's mind about the confidence of the phlebotomist. Grooming and personal hygiene. Physical appearance communicates a strong impression about an individual. Neatly combed hair, clean fingernails, a clean pressed uniform, protective lab coat and gloves, and an overall tidy appearance communicates a commitment to cleanliness and infection control, and they instill confidence in a person. A daily bath or shower, followed by the use of deodorant, brushing teeth, using mouthwash, and appropriate dressing, are also recommended. Hygiene is particularly important in today's healthcare environment, where patients and employees are deeply concerned about the spread of infectious diseases. Employers of healthcare workers are legally required to provide personal protective equipment, or PPE, or barrier protection for workers handling biohazardous infectious substances. This includes gowns, gloves, masks, laboratory coats or aprons, and face shields. Because of latex sensitivities and allergies, employers must provide an array of sizes and styles of gloves and gowns to protect their employees. Table 1-3 describes the dress code. Nutrition, rest, and exercise. The role of a healthcare worker requires physical stamina because the pace is often hectic, and overtime work is common. Good health improves the healthcare worker's appearance, attitude, job performance, and ability to cope with stress. Appropriate eating habits, resting during lunch and break periods, and off-duty exercising are essential to an individual's well-being and stress reduction. Practicing a healthy lifestyle while on and off the duty will facilitate a return to work with refreshed and more productive attitude. Communication strategies for phlebotomists. Face-to-face communication is the most effective form of communication and is part of the phlebotomist's job every day. Verbal interactions can be depicted as a communication loop that starts when the verbal message leaves the sender and is heard by the receiver, as shown in Figure 1-8. The receiver completes the loop by providing feedback to the sender. Feedback can be in the form of a verbal acknowledgement or nod of the head. Without feedback, the sender has no way of knowing whether the message was accurately heard or understood, or if the message was somehow blocked by extraneous factors that can filter out meaning from a message. Filters such as hallway noise, someone else talking, a telephone ringing, etc. can be damaging to effective communication because these distractions do not allow the loop to be completed. Thus, there is a risk that patients will not understand care instructions. Phlebotomists must be sure that the message they send in is the same message received by the patient. Table 1.3 shows a sample of a dress code policy. The basics of communication. The communication loop is complete when the sender receives feedback from the receiver about the intent of the message. Communication can be broken down into three more detailed components. Verbal communication, the actual words that are spoken, the pace and tone of the voice. Nonverbal communication, body language and gestures. Active listening, using verbal and nonverbal information to assess the situation. In patient care situations, the most effective communication involves the following elements: showing empathy for waking up a patient, disturbing him or her, interrupting a meal, see Figure 1.9. Showing respect for privacy and confidentiality for his or her condition, for family members. Building trust, maintain confidentiality, explain procedures clearly, tell the truth. Establishing a professional bond, use common courtesy, show interest. Listening actively, face the patient, maintain a non-judgmental posture, lean toward the patient, establish eye contact, do not interrupt, relax, and listen intently. Provide specific feedback about the patient's behavior, about a procedure, about what the patient said. Verbal communication. Verbal communication involves conveying the right message in a professional tone of voice using language that is appropriate for the situation. Language. Phlebotomists should use simple, everyday vocabulary, particularly with children. Complex medical jargon should be avoided. Patients must not be told this won't hurt. Most blood collection procedures are indeed slightly painful. Therefore, it is important that the patient be forewarned and prepared, such as saying this might hurt a little, but it will be over soon. Sensory impairments. Hearing or sight impairments, deafness or blindness can have an impact on effective communication. However, many technological advances have enabled individuals with impairments a means to live independently and perform tasks of daily living. To assess whether a patient has understood, a question such as, "Is there a step you would like me to repeat before we begin?" or "Do you want me to explain the procedure again?" yields better clues that the patient has understood than saying, "Do you understand?" If it is obvious that the patient did not hear, the phlebotomist should use pre-printed instructions or write down instructions for the patient. If the patient is deaf and requires communication in sign language, all efforts must be made to find an interpreter who can perform the sign language as needed. It is also recommended that writing tools be kept nearby. For patients who are sight impaired, it is most important to communicate the phlebotomist's identity and what he or she is going to do to the patient. Let the patient know who is in the room if there are others. Speak directly to the patient, not a companion if there is one, and do not be afraid to verbally offer your hand for a handshake as a way to introduce yourself. Languages other than English. The diversity of language spoken in this country is extensive. In large city hospitals, it is common to see signage in multiple languages and/or universal signs and pictorial graphics that are easy to understand. Patients who do not speak English can often understand some basics from nonverbal cues, but the phlebotomist must know how to locate an interpreter or use translation services when possible. In the absence of a translator, written instructions in other languages may facilitate the process. Printed cards in different languages can be used to transmit information about the phlebotomy procedure. Because of the proximity of the United States to Central and South America, it is beneficial for some phlebotomists to develop skills in the Spanish language. However, it is recommended that the healthcare worker practice the phrases with someone who can speak the language before attempting to communicate with the patient, because mispronounced words may lead to confusion. Refer to Appendix 6 or Appendix 5 for basic phrases in Spanish. Clinical alert. In some states, children are not permitted to serve as translators for their parents when healthcare issues are discussed. Phlebotomists should check with their supervisors about the applicable laws in their states. Environmental noise. A busy, noisy environment in a clinic or hospital room distracts both the sender and the receiver, often resulting in an unclear message. See Box 1.6, which offers tips for dealing with some communications that may interfere with clear communication. Age. The vocabulary of a toddler is different from a teenager and also different from that of an adult or an elderly person. Phlebotomists should be sensitive to word usage for each age. Remember that it might take longer to explain a procedure to a young child who is more fearful and the pain about the pain than an adult. Whatever the cause, be truthful about the pain and the procedure and use terms that are right for the situation. Pace, tone, and volume of voice. The tone or intonation or pitch of one's voice and the inflection used can change a positive sentence into a negative sounding statement. Volume is the loudness of the voice and ranges from whisper to a shout. The pace, tone, and volume of voice should match the words that are spoken. Sarcasm is usually communicated by changing one tone of voice. Healthcare workers can avoid sending mixed messages to patients by practicing a calm, soothing, and confident tone of voice as opposed to a fast, high-pitched, nervous voice. Box 17 is a practice exercise for healthcare professionals to use observing their own facial expressions and voice modifications. Box 16 is communicating in a noisy environment. A busy hallway, visitors, a television, cell phones, iPods, iPads, and/or headphones can prevent the patient from hearing accurately. In cases where the distractions may occur, the phlebotomist should take steps to reduce the sound level so the patient can hear necessary instructions. Practice using the examples below. To visitors, excuse me, please. It is important for me to explain this procedure to Mr. Jones. Would you mind if we have a few quiet moments together? Thank you for your cooperation. For the television or movie video, Mr. Jones, I'm sorry to disrupt your movie or show, but would you mind if we lower the volume for a few minutes or pause it so we can go over the procedure for collecting your blood sample? Thank you. This should only take a few minutes. For headphones, Mr. Jones, it is important that we discuss this procedure before beginning. Would you mind taking off your headphones for a few minutes? I will be brief. Thank you for your cooperation. Box 17 shows improving tone of voice and facial expressions. Emergency situations. Emergency or stat blood collections are common in emergency rooms and in complicated medical cases. Verbal communications must be fast but professional and accurate. The stat phlebotomy procedures also require extra speed and accuracy without jeopardizing the personal touch. Patients in the emergency room may not have identification information with them and/or may be unconscious. All facilities, however, should have documented procedures for identification process with which phlebotomists should be familiar. Individual patients should be considered in terms of their privacy, dignity, and individual needs, and never by nicknames such as Mr. L down the hall or the broken leg in 3C. Each is entitled to professional, respectful care in all circumstances. Bedside manner. The climate established by a phlebotomist upon entering a patient's room affects the entire patient encounter. The feeling of confidence that comes from the knowledge that the blood collection tray is clean and well stocked is the first step in good bedside manner. Entering the room with a feeling of optimism or positive energy stimulates cooperation. A calm professional tone of voice should begin the introduction. A pleasant facial expression, neat appearance, and professional manner set the stage for a positive interaction with the patient. The first 30 seconds after the phlebotomist enters the patient's room determine how the patient perceives the quality of patient care offered by the hospital. Most patients admit that the procedure they dread most is being stuck for blood collection, so phlebotomists should make every effort to communicate in an encouraging manner. The patient encounter. When encountering the patient for the first time, there are some basic procedures to follow. Knock gently. Do not pound on the patient's hospital door. Introduce yourself and state that you are from the hospital unit or laboratory staff, whichever is the case. See Box 18. Inform the patient that his or her specimen must be collected for a test ordered by the physician. A statement indicating that this is routine hospital protocol often reassures the patient. A lengthy discussion of why certain tests was ordered is inappropriate. These questions should be referred to the physician or to the patient's physician. The most important step in the initial patient encounter is patient identification, and it will be covered in a greater detail later in the text. However, the communication process should be smooth transition from the phlebotomist's introduction to the actual identification procedure. During all steps, remain calm, compassionate, and professional, and limit conversations to essential information. If there are problems or discrepancies, the phlebotomist should calmly indicate to the patient that it may take a few more moments to double-check the information. Let the patient know how the procedure is going. Provide feedback, such as, "This is going well," or "It's almost over." Do not be distracted from the phlebotomy procedure by excessive talk or unrelated issues. Before leaving the room, thank the patient for cooperating. Communication for patient identification. Clear communication practices for patient identification are essential. If the patient is hospitalized, identification should be accomplished by a match between the test requisition or labels and a unique identification number or the armband, and by verbal confirmation from the patient. If a hospitalized patient does not have an armband, some long-term facilities do not require an armband, a positive confirmation must be made by a unit nurse or other authorized individual who knows the patient. This process should be well documented by the phlebotomist. Special identification procedures should also be well documented for ambulatory patients, especially in the case of homebound patients, mobile vans, and other off-site locations. Armbands are not commonly used in ambulatory settings. However, some form of identification card usually is. It may include some demographic data and other identifying information such as the patient's unique identification number, date of birth, a picture, address, or a combination of these. Identity must be confirmed by the patient and the phlebotomist prior to the blood collection. See Figure 110. Some healthcare facilities insist that phlebotomists ask for the patient's complete address, whereas others require the mention of the patient's hometown, birth date, identification number, a street name to reinforce and confirm the identity. Some prefer the patient spell out an unusual last name. This portion of the specimen collection procedure ensures that the remainder of the diagnostic testing protocol provides information on the correct person. Detailed identification procedures are covered in Chapter 8. The right way to communicate to acquire information, as shown in Box 1.8. The following scenario is typical, but simplified, one that might occur at the opening greeting between a phlebotomist and hospitalized patient. Imagine both the verbal and nonverbal factors involved in the patient, for the patient and the phlebotomist. The wrong responses are noted in italics and are sometimes the easiest way to respond. So it is important to train oneself to avoid these phrases. This can be used as a discussion tool about how the phlebotomist can have either a positive or a negative impact. This is Box 1.8. Communication in a clinic or in the home. Phlebotomists who collect specimens in a clinic or home setting must take extra steps to ensure phlebotomy procedures is successful. These steps include the following. The phlebotomist must introduce him or herself and clearly explain the purpose of the interaction. The patient should be directed to sit in a chair with sides and arms or recline during the procedure. This may involve walking to a private area, blood collection booth, or a special recliner. The phlebotomy procedure is taking place in an unfamiliar setting, such as a patient home. The phlebotomist must take extra time beforehand to find the nearest bathroom for hand washing or blood spillage, and the nearest bed in case there are complications during the phlebotomy procedure, such as fainting. In a patient's home, the phlebotomist should bring a mobile phone or computer to clarify laboratory orders or inquire about patient information. Information about the procedure should be fully explained, especially if it is a first-time blood collection for the patient or if it has been a long time since the last blood collection. Identifying the patient should be done meticulously and cautiously, using various methods to identify the patient positively, such as a driver's license or identification card, confirmation of birthday and home address, or other identifiers if available. The puncture site must be appropriately cared for, and it should be clear that bleeding from the puncture site has stopped and that the patient is physically fit to leave the area after the phlebotomy procedure. If the patient is homebound, the phlebotomist must be sure that the patient is no longer bleeding, that the puncture site has been appropriately bandaged, and that the patient is able to stay by him or herself. Role of family visitors and significant others. Family members and friends of adult patients are often present when phlebotomists need to acquire specimens. It is important to realize that their presence can make the patient more secure and comfortable. Sometimes, however, families and visitors are much more difficult to deal with than the patients. They may make requests that are beyond the phlebotomist's scope of acceptable or authorized responsibilities, and it is better then to inform the appropriate healthcare team member of the family member's request. If several visitors are in the hospital room with the patient, they may be asked to step into the hall while the blood specimens are being drawn. If the healthcare worker believes that assistance is required to give emotional support and the patient agrees, a family member may be asked to stay during the procedure. Children should be accompanied by a parent or a guardian. This can make the family members feel helpful and provide reassurance to patients. Physicians, priests, and chaplains have the right to visit privately with patients unless the blood specimen is required at a specific time, such as time specimens. For monitoring drug levels, the healthcare worker should respect the privacy and return to the patient after completing the other draws in the unit or area. If the procedure is needed at a specified time or is that request, the healthcare worker can apologize for the interruption, explain the nature of the request, and ask permission to collect the specimen. Families and visitors of patients, except for parents, guardians, or pediatric patients, should not be permitted in the clinical laboratory or provided with patient information, except by prior agreement and permission of the patient. The patient's privacy and safety and the confidentiality of patient records must be considered. Nonverbal communication. Some theories suggest that communication consists of 10 to 20% verbal and 80 to 90% nonverbal message. Nonverbal cues or body language can be positive and facilitate understanding, or negative and hinder effective communication. See Table 1.4 and Figure 1.11. Clinical alert. The patient should always be asked, could you please state your name and spell it? Not, are you Miss Smith? The question is more reliable and a direct way of confirming who is heavily medicated. Is more reliable and a direct way of confirming identity. The second question is inappropriate and less reliable because a patient who is heavily medicated may agree with anything that he or she is asked. Positive body language. Smiling. A simple, compassionate smile can open lines of communication by making each patient feel that he or she is the most important person at the moment. In addition, most people look better with smiles on their faces than they do with frowns. It takes fewer muscle movements to smile than it does to frown. Eye contact and eye level. Eye contact promotes a sense of trust and honesty between the patient and the phlebotomist. There is an expression, the eyes are the windows of the soul. Eye level is also a consideration because bedridden patients must always look up to those in the room. It can create a feeling of intimidation or being looked down on, or of weakness. Most of the time, phlebotomists do not have the extra time to spend finding a chair to sit in so that they are at eye level. However, if a healthcare worker must explain a lengthy procedure, or if it is noted that the patient is particularly nervous about the procedure, the explanation should be done while seated at eye level with the patient. See Box 1.9. A word of caution about eye contact is needed when dealing with patients of certain cultures. Generally speaking, Americans view eye contact as a positive aspect of human nature. An avoidance of eye contact might mean that someone is not being truthful. However, some Asian and Native American cultures believe that prolonged eye contact is rude and an invasion of privacy. Muslim women may avoid eye contact because of modesty. Patients may not appreciate direct eye contact with a healthcare provider because it may make them feel self-conscious. It may be unacceptable in their culture or may not be acceptable with the opposite sex. The phlebotomist should take cues from the patient. If the patient does not look at the healthcare worker when he or she is speaking, perhaps he or she would feel more comfortable with more space between them or less direct eye contact. A phlebotomist can take the interaction at a slower pace to monitor the patient's comfort level. The more secure and comfortable the patient feels, the easier the procedure will be for the phlebotomist. Box 1.9 shows practice exercise for developing sensitivity to bedridden patients. Face-to-face communication. Phlebotomists should face patients directly. Otherwise, the patient may feel neglected, that he or she is being avoided, or that information is being withheld. If a patient turns away from a phlebotomist, however, it should be taken as a cue that the patient is uncomfortable for some reason. The phlebotomist should do everything possible to make the patient feel more comfortable during the phlebotomy procedure. Zone of comfort. Most individuals begin to feel uncomfortable when strangers get too close to them physically. A zone of comfort is the area of space around a patient that is private territory, so to speak, where they feel comfortable with the interaction. If that zone is crossed, feelings of uneasiness may occur. For most Western cultures, there are 4 zones of interpersonal space. Intimate space, direct contact up to 18 inches for close relationships and healthcare workers who bathe, feed, dress, and perform venipunctures. Personal space, 18 inches to 4 feet, for interactions among friends and for many patient encounters. Social space, 4 feet to 12 feet for most interactions of everyday life. Public space, more than 12 feet for lectures, speeches, and so on. When a stranger gets too close, it can cause the patient to feel nervous, fearful, or anxious. Healthcare workers must be understanding and approach nervous patients slowly and gently, to avoid causing feelings of being threatened. This is particularly true with children, many of whom have a wide zone of comfort, that is. They do not like anyone to approach them except close relatives or friends. It is helpful to slowly approach the patient while crossing the zone of comfort, not to be too hasty, and to talk to the patients during the process. Cultural sensitivity. Culture is a system of values, beliefs, and practices that stem from an individual's concept of reality, as shown in box 110. Culture influences decisions and behaviors in many aspects of life. Learning about various ethnic groups and culture is important for healthcare professionals to understand the reason for patients' behaviors during times of health and illness. Box 110. What is culture? Culture is an important aspect of our global society. Culture varies among groups and individuals, but is usually encompassed by the following traits: values, the accepted principles in a group, individualism versus socialism, importance of education and financial security, competition versus cooperation, sanctity of life, and so on. Beliefs, doctrine or faith of a person or a group, spiritual orientation, family bonds, and so on. Traditions and practices, customs and behaviors associated with groups, holidays, food, music, health, dance, care practices, and so on. Specific traits that vary among cultures have been addressed previously, such as eye contact and zone of comfort. However, with the changing demographics of the U.S. population, it is vital for all healthcare workers to become more sensitive and compassionate about accepting cultural practices that vary from our own. More importantly, cultural awareness promotes effective patient communication. When a healthcare worker is unsure or unaware of the acceptable patterns of behavior for a patient, the recommended action is to follow the patient's lead. For example, if a patient speaks softly and slowly, speak the same way. If the patient turns to a family member when speaking to you, include the family member in the conversation. If a patient moves closer to you during the conversation, try not to back away from the patient's zone of comfort. Ways to become more compassionate and culturally competent are to allow patients to teach us, their spouses and family members, and allow patients to teach us to become active observers of how culturally diverse patients interact with each other, their spouses and family members, and with healthcare professionals. Becoming keen observers of patient preferences, mannerisms, gestures, and facial expressions, reading about cultural groups, watching films and videos, reading novels about cultural difference from one's own, and reading newspapers published by cultural groups will make healthcare workers more informed, empathetic, and better at what they do. Box 111, My Space, Your Space exercise, finding your comfort zone. Negative body language and distraction behaviors. Wandering eyes. When people roll their eyes upwards, they convey the sense of being bored, inattentive, or unwilling to perform a duty. The same can be said about gazing out of the window or looking up at the ceiling. If a phlebotomist enters a patient's room and begins addressing the patient while looking out the window, the patient will feel neglected, and the phlebotomist will appear unconcerned. However, a friendly comment about the weather outside might be appropriate when the phlebotomy procedure can be continued when full attention. Then the phlebotomy procedure can be continued when full attention can be given to the patient. The objective is to make the patient feel at ease through some good communication techniques so that the procedure can be successful. Nervous behaviors. Behaviors such as squirming or tapping a pencil or a foot can be very distracting. They can make a patient feel nervous, hurried, or anxious about the venipuncture. On the other hand, it is helpful to recognize these behaviors in patients too, especially children, so that efforts can be made to reduce the fear. Allowing an extra moment of conversation or preparation may help. Breathing pattern. A deep sigh can convey feelings of boredom or reluctance to do the job. Likewise, if a patient sighs deeply or moans at the mere sight of the phlebotomist, this should be a cue that a little extra attention, conversation, or a smile might ease the patient's reluctance for the procedure. Other distracting behaviors. Many other actions can convey negative or defensive emotions from the perspective of the healthcare worker or the patient. Among these are crossed arms, a wrinkled forehead, frequent glances at the clock or a watch, rapid thumbing through papers, chewing gum, yawning or stretching. Healthcare workers should realize that these behaviors can distract from their professional image when they are communicating with patients, families, visitors, co-workers, and supervisors. Active listening. Another component of effective communication is the art of listening. Active listening helps close the communication loop by ensuring that the message sent can indeed be repeated and understood. Listening skills do not depend on intellect or educational background. They can be learned and practiced. Table 1.5 provides tips for becoming an active listener in your professional and personal life because individuals can mentally process words faster than they can speak them. A good listener must focus on the speaker to keep his or her mind from wandering. Listening carefully to the patient can have important ramifications in the test results. For example, the inpatient may have been instructed that he or she will be fasting or will have nothing by mouth until the early morning blood collections. The phlebotomist should listen to patients' comments such as, I didn't have breakfast yet, and they won't feed me. Even a question or comment about food may inspire a response to confirm that the patient was truly fasting. When in doubt, the phlebotomist can confirm that the patient has been fasting by simply asking the patient if he or she has eaten or had anything to drink other than water. Table 1.5, Steps for Active Listening. Get ready. Concentrate on the speaker by getting ready to listen. Take a moment to clear your mind of distracting thoughts. Begin the interaction with an open, objective mind. Taking a deep breath may help clear your mind and prepare it to receive information. Pause occasionally. Use silent pauses in conversation wisely to mentally review what has been said. Verify that you are listening. Let the speaker know you are listening by using phrases such as, I see, oh, very interesting, and how about that? Avoid making hasty judgments. Keep personal judgments to yourself until the speaker finishes relaying his or her idea. Listen for true meaning in the message, not just the literal words. Provide feedback. Verify the conversation with feedback to make sure that everything was clear to the receiver. Ask for more explanation if necessary. Mentally review the key words to summarize the overall idea being communicated. Paraphrase the conversation to ensure complete understanding. Notice body language. Pay attention to body language and ask for clarification. Simple prompts such as, you look sad and you seem upset or nervous can add more meaning to conversation and encourage the speaker to verbalize feelings. Maintain eye contact. Eye contact communicates interest or concern. Use encouragement. Encourage the listener to expand his or her thoughts by using simple phrases such as, let's discuss it further, tell me more about it, and really? Practice active listening at work and at home. Telephone and email communication. Because the telephone is a vital communication tool for all healthcare facilities, it is important to follow the rules of good communication for incoming or outgoing calls. Some facilities have procedures for telephone communication, such as those listed in Box 112. In addition, regarding the use of personal cellular phones while at work, most healthcare facilities discourage the use of cellular phones, talking, or texting, except during authorized meals or short breaks. Email communications are considered legal documents and are admissible in court cases, so it must be used in a highly professional manner. Follow the facility's policies for the authorized use of email related to transmission of patient data, departmental information, etc. In general, however, it is important to reply to email in a timely manner with accurate information and with the utmost concern for patient confidentiality. Avoid language that is offensive, obscene, or not factual, and avoid the use of excessive symbols such as exclamation points, question marks, percentage sign, dollar sign, hashtag, etc. Box 112 shows guidelines for telephone communications. Quality assessment or quality basics. The quality of phlebotomy services can encompass many factors that involve organizational structures, processes, outcomes, and customer satisfaction. The area where individual phlebotomists have the greatest impact is on constantly improving the services that are provided to stakeholders or customers. Quality improvement efforts for phlebotomy service often involve evaluating the following: the healthcare worker's technique, complications such as hematomas, recollection rates resulting from contamination, multiple sticks on the same patient, turnaround times, the time it takes from when the laboratory test is ordered to the time the final result is reported. All these issues have potential to result in negative outcomes for the patient. Thus, continuous improvement in minimizing these problems would be most beneficial to the patient and the healthcare worker. Examples of stakeholders or customers in healthcare. Stakeholders are also considered to be customers. External stakeholders are individuals or groups outside the organization. Internal stakeholders are individuals or groups within a healthcare organization itself. External stakeholders: local community, insurance companies and employers that pay for the services, grant agencies and/or foundations that provide funding, federal or state agencies, accrediting agencies such as the Joint Commission, advocacy groups such as AARP. Internal stakeholders within the healthcare organization and/or specimen collection services, inpatients and outpatients, patients' families and friends and support groups, clinical laboratory staff, pathologists and other medical doctors, students, research staff, and/or volunteers. A quality plan for phlebotomy services. Quality assessment for phlebotomy involves reviewing structures, processes, outcomes, and customer satisfaction. Assessment of structure. Physical or organizational properties of the settings where care is provided. Assessment of structural competencies include physical structure, facilities where services are provided, adequacy of supplies and equipment, safety devices, safety procedures, and availability and condition of equipment such as computers, sterilizers, refrigerators, thermometers, centrifuges, autoclaves, and glucose monitoring devices. Personnel structure. Adequate numbers of personnel and support staff ratios of staff to patient, qualifications of staff, and availability of the medical director or supervisors. Management administrative structure, updated available procedure manuals, adequacy of systems for secure record keeping, and open lines of communication throughout the organization. Quality assessments of structural components may reveal potential problems that other assessments cannot. For example, the use of outdated blood collection tubes may cause faulty laboratory results, even though the blood collection testing and reporting processes are perfect and the treatment plan for the patient is appropriate. Page 32. Assessment of process. What is done to the patient or client? Process assessments are common throughout the specimen collection and clinical testing arenas and include procedure and skill assessment. This is where traditional quality control measures are applicable. Examples of QC measures that phlebotomists may be involved with are checking the expiration dates of supplies such as needles and specimen tubes, monitoring temperature of specimen refrigerators, performing equipment checks for point-of-care instruments, performing preventative maintenance on centrifuges, and routine cleaning of surfaces where specimens are collected or processed. In addition to the normal laboratory data collection routines, however, other methods are effective for monitoring processes. These include evaluation of patient records for complications, correct technical skills, and correct documentation procedures, direct observation of practice, videotaping of healthcare interaction and practices, patient interviews, and questionnaires. Assessment of outcomes. What is accomplished for the patient? Most outcome assessments rely on information in the patient's medical record. Chart reviews usually evaluate the health status after services are provided. Time is usually an important component of these measures. Outcome assessments are typically the most difficult to measure and often relate to recovery rates, infection rates, incidence of iatrogenic anemia, anemia caused by medical treatment, in this case excessive blood removal, return to normal functions, and so on. Poor patient outcomes have been described as the 5 Ds: death, disease, disability, discomfort, and dissatisfaction. The 5 Ds again are death, disease, disability, discomfort, and dissatisfaction. Customer satisfaction, knowing why the customers are dissatisfied and which customers are unhappy. The study of satisfaction among patients is accomplished by using questionnaires, surveys, and telephone or personal interviews. Clinical alert. Unfortunately, phlebotomists can have a negative impact on quality, the 5 Ds. For example, misidentification of a patient can result in an erroneous cross-match in blood transfusion, which could be fatal to the patient, death. Inappropriate cleansing techniques or hand hygiene could result in transmitted nosocomial infections, hospital-acquired disease. Repeated blood collections or drawing too much blood at one time can result in iatrogenic anemia. Poor venipuncture techniques, such as improper needle insertion or excessive probing, could result in nerve damage, causes disability, or severe pain, discomfort. And lengthy waiting times, rude behavior, or messy work sites can contribute to a patient's negative feelings or dissatisfaction. Tools and practice exercise for performance and assessment. In a laboratory, check sheets, run charts, and statistical tests can be used to review both the analytic and non-analytic parts of the laboratory. The phlebotomist should should be a routine part of quality performance assessments. Tools for implementing continuous quality improvement, or CQI, include the following: flowcharts, useful for breaking a process into its components so that people can understand how it works, Figure 112. Pareto charts, bar charts that show frequency of problematic events. The Pareto principle says that 80% of the trouble comes from 20% of the problems, as shown in Figure 113. Cause and effect, Ishikawa diagrams, diagrams that identify interactions between equipment, method, people, supplies, and reagents, as shown in Figure 114. Plan, do, check, act cycle, or PDCA, a cycle for assessing and making positive changes, then reassessing the effects of the change. Line graphs, histograms, scatter diagrams, pictorial pictures representing performance trends. Brainstorming, a method used to stimulate creative solutions in a group, as shown in box 113. Box 113 shows a brainstorming exercises. Quality and specimen collection services. Phlebotomists can consider the clinical laboratory testing process in several phases, such as pre-analytical, analytical, and post-analytical. These phases in specimen collection, processing, and testing are part of every laboratory's operation. For purposes of this test, quality assessment discuss and focus on the pre-analytical phases where the phlebotomist has the most impact. Refer to box 114 to review examples of aspects of quality assessment for phlebotomy services, and box 115 lists the basic requirements for a quality specimen. A periodic review of the laboratory's collection procedures and policies is recommended to reduce collection errors. Box 114, quality assessments for specimen collection service. Worker response time for inpatients. Patient waiting time for outpatients. Time required for completion of the phlebotomy procedure. Percentage of successful blood collections on the first attempt. Number of successful blood collections on the second attempt. Daily blood loss per patient due to venipunctures. Number and size of hematomas. Number of patients who faint. Amount of time spent and number of telephone calls needed to acquire appropriate identification. Number of redraws due to inadequate specimens. Turnaround times of designated laboratory tests. Frequency of incomplete data, documents, logs, and so forth. Number of therapeutic drug monitoring tests with incorrect time and documentation. Number of specimens received in incorrect tubes. Contamination rate of blood cultures. Patient satisfaction questionnaires and frequency of complaints. Box 115, basic requirements for a quality specimen. Aspire to provide the highest quality patient specimens in professional and safe environment 100% of the time. Be familiar with the following requirements. Number 1, using standard precautions. Identify, assess, and properly prepare the patient and avoid medication interference if possible. 2, collect specimens from the correct patients and label appropriately. 3, use correct anticoagulants and preservatives and collect a sufficient amount of blood with use devices that minimize accidental needle sticks. 4, handle specimens carefully to prevent damage and/or hemolysis. 5, collect fasting specimens in a timely fashion and verify that they are actually fasting samples. If they are not, note the condition. 6, collect timed specimens at the right time and document accurately. 7, allow specimens without anticoagulants to stand a minimum of 30 minutes so that clot formation can be completed. Some tubes, depending on the manufacturer, may shorten the time of clot formation. 8, transport specimens to the clinical laboratory in a timely fashion within 45 minutes, and it is recommended that blood cells be separated from serum or plasma within 2 hours. Document a list of specimens that are delivered after the designated time limits to help detect the source of problem if necessary. Important factors affecting quality: anticoagulants and preservatives. Phlebotomists use anticoagulants and preservatives in the collection of blood specimens. A more thorough discussion is presented in Chapter 6. Phlebotomists are responsible for filling the tubes in the correct order so that carryover of anticoagulants to other tubes will not occur, and for mixing the specimens with the anticoagulant promptly after the blood is drawn. When restocking the supply of collection tubes, phlebotomists should place the tubes with a shelf life or expiration date nearest the current date at the front of the shelf so that these tubes are used first. The phlebotomist should be cognizant of expiration dates on any item used in a specimen collection. Phlebotomists should know how to store or preserve specimen tubes if the blood specimen is not to be tested immediately. Number of blood collection attempts. Many laboratories periodically monitor the number of unsuccessful blood collection attempts, i.e. the number of times a patient is stuck unsuccessfully. If a phlebotomist has had consecutively unsuccessful phlebotomy attempts on different patients, his or her blood collection techniques must be reviewed, modified, and approved. Blood loss due to phlebotomy. For adults, blood loss due to venipuncture is usually well tolerated physiologically because the volume constitutes a small percentage of the total blood volume in the body. However, in some cases, if patients are very ill, more laboratory tests are ordered, which results in more total blood collected. The same is true for neonates and infants. When too much blood is taken for laboratory analysis, the patient may become anemic, so blood conservation becomes a priority. If too much blood is withdrawn, clinical alert. If too much blood is withdrawn in a short period of time, a patient may become anemic and require blood transfusion. This type of induced blood loss resulting in anemia is called iatrogenic anemia. It is important to monitor daily blood loss if patients are neonates, have poor prognoses, or are being tested frequently. In these cases, the use of smaller test tubes and/or micro collection techniques is warranted. This concludes Chapter 1.